Hello and welcome to the Ascend Health Show. I'm Nick Angelis. I'm your host, I'm a nurse anesthetist, and I'm the owner of Ascend Health Center. And I'm here with Tamara Bowling, a psychiatric nurse practitioner who just started with us this week at Ascend Health Center.
Yes, I'm very excited.
Not as excited as I am, it's great. Well, our patients have been asking for a female nurse practitioner for quite some time, which is really funny because if they ask for any other class of person, it's like, no, that's inappropriate. But in this particular case, it's like, yeah, that actually makes a lot of sense. There's enough guy talk around this clinic. Let's get you a female nurse practitioner. Yeah. So I'm very glad to have you both at the clinic and on the show.
Well, I'm very glad to be here, and I cannot wait. So
yeah. Well, why don't we start with, before I get off on tangents, which will probably happen about 30 seconds into the show, per usual. Why don't you tell us a little bit about yourself, like how you decided to become a psychiatric nurse practitioner? Because before this, you were also a family nurse practitioner.
Correct.
So you can go back as far as like if you were 8 years old and decided to be a nurse, or just how you decided to get into psychiatry, whatever is more fascinating for you.
Back when I was working as an RN in the emergency room, I worked in an emergency room that was the intake for the entire city of Rochester, New York.
Wow.
For all the psych patients. So everyone was brought there. I got, I would say, interested probably at that point. I really enjoyed working with those patients, differentiating who was impaired or under the influence of substances or mental health issues or both. And then after I became a family nurse practitioner, I spent some time working in urgent cares and also some primary care clinics, and found that so many of the patients that were coming in had either addiction issues or substance use disorder issues or both.
Wow.
Right. So I found that I really enjoyed talking with those patients. There's a lot of stigma that they feel when they come into the healthcare system, and making them feel accepted and like somebody wants to help them. I found that that was really rewarding. So I wanted to, what I did was first is I ended up going into addiction medicine while I went back to school for psych. So,
interesting.
Because there's such a tie-in between the two, often go hand in hand. So that's how I got involved in psych.
No, it makes sense. I mean, that's one of the reasons that we started Ascend Health Center, was we realized so many of these patients have to go to the ER. There's no other options for them. And sometimes it still is. We sometimes send patients straight to the emergency room as well. But we're like, well, there has to be other cases where there's some alternative or there's some in between. So, I mean, actually, before COVID, we would have patients, if they didn't feel safe, but they weren't so bad that they need to immediately go to the ER, we'd have them hang out in our waiting room. Just like, well, just come hang out with us for a little bit till I see if you feel better. And obviously that's unique to us being in the Fair Lawn area, so it was mostly patients who lived a few minutes away, where we would just tell them, well, just stop on by, see if you feel any better. But it's so difficult when you see them all in the ER because it's not meant for mental health, and sometimes I feel it can make the mental health worse.
Yeah, they don't have, a lot of the providers that work in those settings don't feel comfortable really dealing with those issues. And so I don't think that the patients, they don't feel that somebody there is really hearing them and knows what to do. And so I think that's one of the challenges that we face in those settings. And as we know, it takes a long time to get somebody in to see a mental health provider.
Right.
So, yeah.
Unless you come to Ascend Health Center now, that Tamara can see you within a week. But you're right. Anywhere else in Akron, Cleveland, good luck. It'll be 2 or 3 months.
Yeah, exactly.
It works out. And sometimes it's challenging too, because finding the right fit. So once in a while we'll see a patient and we tell them like, well, you know what, we're not really sure if you are a right fit, but we also know it's months until you can get in somewhere else. So if you're fine with either a second opinion or we might not take on your care, then let's do this.
Right.
And again, it's that same challenge of how can we break down these barriers and at least get people seen and get the conversation started to see what they really need.
Absolutely.
So, well, one question I had, and this will be a long question, which you're not supposed to do in TV. Did you know that? Like, I'm supposed to ask really short questions so that we don't lose the audience's attention. But instead, I ask some sort of meandering thing, and usually the guest is, wait, what was that? So, and this is, I think, like my 46th show, so I've learned nothing. Just so you know.
Well, I can try to make short answers, but.
Yeah. or you can try to guide me. You know, like a lot of times I'll have therapists on the show, and it's basically my personal therapy. So we'll figure it out. So, but there's an article in the New York Times about this recent trend to self-identify with social media. I hate to use the word, but influencers. So they'll say, look, I've got borderline personality. This is what I'm like. And then someone watching like, ooh, I have that too. And it's really more like horoscopes that, oh, that's exactly what a Scorpio would say, or, oh, wow, you must be a Virgo, where you see one salient fact and then you generalize it for everything.
Right.
But at the same time, some of it is a little healthy because, as you said before, you know, there's a stigma with mental health. A lot of times people don't want to talk about it. But what do we do when it's gone the other way, where someone comes to us and says, you know what, I absolutely have this issue?
Yes, and I think we've all seen that in practice lately. TikTok has been a big influence on people, and people want to feel like that they belong and that they're part of something. And I think sometimes that is behind some of their desire to think they have this diagnosis, because now they're part of this group, right, of people that have this. So it can be a little bit of a challenge, but I think the first thing I usually do is talk to the patient and have them tell me why they think they have this, so that I can get an idea of where their thoughts are around what they think they might be feeling, because most of the time it's going to be the case where it's not something that's going to be a diagnosis for them. But I do want to hear what they have to say about it. And then, you know, we form our diagnoses based on the DSM-5 criteria, and that's how we come up with a diagnosis. People have to meet certain symptoms, I guess I would say symptoms, or issues that they might have, and then we follow those criteria to make that diagnosis. So a lot of times what I will do is I will get out the DSM-5 and we'll go over it together, you know, and is this something that you have? Is this something that's a problem for you? And usually then when they go through that, they'll realize that, no, this isn't me. So yeah, so that can be really helpful in
Well,
those
it's probably good
situations.
training too, because part of psychiatry is that psychotherapy standpoint. And so if you're teaching them, well, how do you feel, what's going on, and then over time they, and the word self-diagnose has negative connotations, but in a good way, they can have a better sense of what's going on with me. You know, do I need an appointment with a therapist? Do I need to see my psychiatric nurse practitioner? Do I just need to be by myself without my phone for a few minutes? And as they learn those skills, then they'll need us less and less, which is, of course, the whole goal of what we're trying to do, is take people from a place of desperately needing medical help to, in most cases, being able to know what the right intervention is, and then, you know, if they still need us, they'll reach out to us.
Absolutely. And I think sometimes too, there might be something going on with that patient still that you haven't uncovered yet. And sometimes that can give you a sense of what that is. It's not that they have that diagnosis, but maybe something else is going on with them. And as you said, in that case, it could be just you really need some more therapy. You need to work through this, or process this, or something like that. So it can also give you insight on sometimes things that the patient might be going through that you haven't really been able to, you know, discuss yet.
So it might almost be like peeling an onion, that, okay, you don't fit these criteria, but if you continue to work on you, as things continue to go up, then we might actually find out what's at the core of this.
Right, exactly.
That makes sense. That's often how the ketamine infusions work, where I tell the patients this might be a little rocky. It might stir up some things that have been repressed or bring to the surface some subconscious issues, but it allows us to get a better understanding of what's going on. Because it does serve as a mirror of the person sees themselves as they are. And this is a bit more like the psychedelic mystical side of it as opposed to the science. But and sometimes it's difficult for patients. For example, the patients who don't do well at all with ketamine infusions are those who have physical pain but deny any sort of mental health issues, that they say this is, and sometimes this is true, where it's just a physical issue. We don't have to deep dive into how did my childhood affect this pain. It's just, you've got some pain. So I don't want to make everything more profound than it is. But in many cases, the physical and mental health are tied together, and because the patient has denied that connection, we instead see that, oh wow, like there's a lot of stuff here that we need to deal with. So.
Right. Very helpful to uncover things that maybe they haven't even approached.
Yeah, absolutely. We may have lost our cameras. I'm not sure. This may have just turned from a.
You're good.
Oh, okay. That would be kind of neat though if it went from a video to all of a sudden, oh, we're a podcast now. I was defining that for one of my guests. If you have an oversized microphone between us, then we're officially a podcast.
Oh, I didn't
Without
know that.
Then I think
Okay.
we're just a TV show. Yeah, in the loosest sense of the word. See, we don't only diagnose patients, we're diagnosing what we're doing actively here. A little bit of metacognition there for everybody. So you're saying that we're taking deeper dive, you're seeing what's at the root of it. We're also careful not to overanalyze it, because that can be an issue too. So, and this is honestly from my own knowledge too, what's the correct balance? Because I've had many patients who are trying too hard for their mental health, analyzing every thought. Am I getting better? Is this working? What's going on?
Yes.
One case is a patient who said, I'm going to quit my job to focus on my mental health. And it didn't work out. She just stayed all day in bed. So a lot of times it's one of those things where it's almost like pursuing happiness. Like if you're so, I must be happy, you're not going to be happy. You're going to be miserable, and everyone else around you is going to be miserable. So what's the correct balance to try to ferret out, like, what's going on with me? Sorry, that was one of those like long questions I warned you about.
Yeah, it's it's so individualized on how people deal with things, and there are people that sometimes when you get into therapy, or it could be medication as well, but it can actually make someone worse before they start to improve.
Sure.
Because as we uncover some of these things, especially when it comes to trauma, it can be very painful, and it can cause symptoms that maybe they didn't even have before initially. So there are times, I think, when people need to kind of walk away from not treatment so much, but trying to focus on analyzing everything that's going on with
Sure.
them, and just take a break from that. Because if you're overthinking it all the time and you're pushing yourself, that's a form of stress and pressure as well.
Right.
And you're not going to be able to accomplish the things that you want if you're adding increased stress to what's going on with you. So I think that it's important to recognize, when someone is maybe overloaded or pushing too hard, or
Right.
Trying to think that, if I do this, if I just get into this more and more and more, it's going to make me happier and happier, and it's not always the way it works. So I think
That
letting
makes
them know that is
Yeah, the freedom to
Yeah.
not be 100%. The freedom to take your time with healing that. Because there is this expectation in American culture that I gotta be as good as I can be at all times and do all these things. I was talking to a clinician the other day who's a single mom, and I was like, well, look, you're trying to juggle all these balls, and by necessity, one of them has to hit the ground at all times. Like, you can't do all these things and do them all well, and that's part of the acceptance process.
Right.
So it's sort of like you're saying, sometimes we need to get to the root cause and heal the issue, and sometimes we need to just slow down and do some symptom management for a while.
step back a little bit.
Which sounds terrible to me because I come from this natural health world even before I became an anesthetist, where you have to always get to the root cause. And even a lot of the things I talk about Ascend Health Center, it's always like, let's get to the real problem. But that's exhausting after a while.
It is, because it's a journey, and it's not quick. Usually it takes some time, which is another thing. I think it's really important to let people know, patients need to understand that we don't have like a magic pill per se that's going to make everything better right away and make everything go away, make your life perfect.
Right.
It doesn't work like that. Life's up and down like this normally. So I think that setting that expectation that this is a journey, and
Right.
it's going to be maybe a little while before you get where
I
you want to
agree.
be.
And I feel like the best treatments that we have at Ascend Health Center actually revert the patient to this kind of life. That instead of being like at a low normal functioning because of some antidepressants, sometimes the TMS or the ketamine will actually restore the normal fluctuations of life And the patient's like, what's going on? And we just say like, no, a more natural, more permanent way of healing is to get back into the rhythms of having a good day and a bad day instead of multiple blah days.
Exactly. And sometimes it's really uncomfortable for them because their comfort zone is being used to that, maybe that blah, or people that are the other direction and maybe a little hypomanic and a little bit up here all the time.
Right.
When they get into more of a normal pattern, at first it's a little disconcerting, maybe confusing, and they have to readjust
Right.
to that.
I mean, it's challenging for me as a person, and I probably have some diagnoses that we'll discover before the end of the show. But I'm always busy. Besides owning the clinic, I have all these little side anesthesia gigs so I can keep up with my skill set in case I need to, I don't know, anesthetize somebody in the middle of my clinic in Fairlawn. And I realized over time that, nope, this is this hero complex of like, I must save everyone, do all the things, be always busy all the time. And so for me, it's like, no, I need to take some time off. I need to make sure things aren't running at full capacity, because we were talking about this the other day in mental health. Practitioners come and go often. There's a lot of burnout that occurs, and it's actually a terrible idea to run at full capacity or to, you know, I almost want to say it's terrible to give 100%. That sounds so blasphemous. Maybe there's a better way to say that. But you have to pace yourself. Maybe that's a better way. As both patients and providers, there's a pacing of, do we need to quickly solve a problem? Can we take our time? And really also normalizing patients taking a break from treatment, because it's almost another stigma, yet another stigma of like, what do you mean you stopped seeing your psychiatrist? This is awful. And sometimes like, no, I need a break from this, and finding ways to do that in partnership with the patient instead of them just dropping off or no showing of like, no, let's take a step back and that's fine.
Yeah, so they need to know that you are not judging them and they shouldn't feel bad if they do need to take a break. I'm a big believer in shared decision making when I work with patients. My main focus initially is creating that connection and trust, not jumping on something right out of the gate, you know, and working with them for making decisions as far as their treatment, because they know what they're feeling, they know what works for them and what doesn't. So I think that if they feel that you're accepting, and you know, I've had patients say to me, especially in trauma situations, they were in therapy and they're starting to get to something that's really painful and right kind of at the root. Right. And they may start having much worse symptoms. They may have more nightmares, or they may have, you know, a little bit much more difficult maybe than where they had been, as far as now they're maybe reluctant to come to therapy, and you know, and sometimes then in that case it's the best thing to do is just to say, you know, let's take a little break from this for a little while and let you have some time, and that can be very helpful.
I really like what you said about rapport. I feel that earlier in my career, the goal was, well, let me quickly fix something so the patient can see that I'm this brilliant genius, and then they'll trust me. But that's not how it works. It's more like, let them see that I care, let them see that I'm being careful and considerate, and then everything else. Because sometimes we have these genius answers and sometimes we don't. And it's important to have that relationship, so that, because again, we're talking right now about mental health. So the relationship is a core part of getting better.
Yes, because a lot of the patients that we have are ones that have been on a number of medications. Right. They've had bad side effects, or they feel like they haven't been helpful. And I hear, you're not going to just put me on yet another thing right away that's not, you know, they're at that point they're frustrated, and which is one of the reasons that we're doing the treatments that we are at Ascend. But yeah, so building up that trust first, getting to know them sometimes is very helpful, as far as knowing what treatment decisions, and then I discuss it with them always. This is what we can look at. This is what the alternatives are. This is what the pluses and minuses are and side effects, and let them be in that decision-making process rather than going in and having somebody just give them a prescription.
Like,
here you go.
Sad, take this.
Yeah, and a lot of them have experienced that.
That's for sure.
They're kind of gun shy.
And does that help you also pinpoint a diagnosis? Because sometimes, a therapist will say, well, this is bipolar disorder too. And then the psychiatrist or the nurse practitioner say, oh no, what you've got is depression and this was just a one-time episode of hypomania. So what do you do in those cases when there's different ideas of what's going on?
Yeah, well, you need to recognize, first of all, that in one visit, one little chunk of time, you are not going to really be able to discuss everything fully, to understand that patient. That takes a little bit of time. So when it comes to certain things, especially like personality disorders, for instance, you need to really get to know that patient sometimes before you give them a diagnosis, because new symptoms can come up that they tell you about, or behavior as you get to know them that you see that they might not recognize. And so there is a fluidity to it as well. And so, and good communication with therapy. If they're working with a therapist in your same office, it's great because they can come and say, hey, I'm worried about this because of this, and then maybe you can explore that further.
And really part of it is, and maybe this is mainly my personality, but we don't all have to agree, because this isn't like a black and white issue. These people are multifaceted as we're trying to see what's going on, and over time it'll express itself. Sometimes it is because, oh, this medicine worked well, we didn't think you had this, but maybe there is an angle of this. Because again, mostly at Ascend we're discussing with patients who've tried multiple medications and been diagnosed multiple times with all sorts of different things. And it's probably still also important for them not to find their identity in that diagnosis because of how fluid it is.
Yeah, and different points of their life. I think there's been a problem lately of people getting diagnosed with bipolar disorder in rehab, inpatient addiction treatment facilities, detox, and they really are being diagnosed at an inappropriate time for you to do that. I mean, if somebody is using methamphetamine and they're coming off of that,
we'll see a wide range of behaviors and emotions.
Exactly. So we've been getting a lot more patients that say they were diagnosed with bipolar disorder, and as you see them, you get to know them, you talk to them, you realize this doesn't sound like bipolar disorder. But your point about medication response can also give you a cue to things, because a patient could have a response to a certain medication and then they take that and you say, oh yeah, maybe we need to look at this. So I think that's the big key is we're not all going to always agree. We're not always going to agree at different times. Somebody could be diagnosed with something 6 years earlier, you know, and then you're seeing them and everything's completely different. So recognizing that and allowing the time to really understand the patient, I think, is key.
So you're saying there's a practicality with it, that, hey, this medicine is working, we're going to go with it. You know, because a lot of times we'll see this with the ketamine infusions where patients say, well, I think I have chronic Lyme disease, but maybe I have this. And sometimes it's like, well, you know, financially speaking, I feel that you can afford an extremely accurate diagnosis, or we can start some treatment, but you can't afford both. So which way do we go? And there's always that risk of, well, what if we use the wrong treatment? But again, when we're talking about complex disorders that have innervations into physical and mental health, and everything is all tied together, you do have to start somewhere and see if you can make some progress before you move forward.
Right, exactly. And if something is really helping, we don't want to rock the boat.
Right.
You know, which is another thing. So,
and that can be a challenge sometimes with insurance companies, but that's where we'll have peer-to-peer meetings with the insurance company and try to explain to them that, no, this is working, let's not make this too complicated, just let them take this drug. So, and then my last question would be, you've mentioned the methamphetamines and how you've come from a background where you dealt with a lot of addiction. What's been most helpful for those patients where they're struggling with addiction and mental health issues, and again, it's all kind of combined into this complex web?
Yeah, I think the biggest thing to remember with patients with addiction issues is you really need to be non-judgmental. That is number one. You need to make them feel accepted, and get that relationship going with them, because they've been judged so many times that they're very much, a lot of them, reluctant to work with you. So that, I think, is the number one important thing. And then a lot of it is, you know, we don't know all the time what comes first, the chicken or the egg. Are we having addiction issues because we're self-medicating for a mental health issue, or are we having mental health issues that have led to the addiction?
Right.
There's a lot of taking a look at that kind of component. I think one of the biggest challenges, though, is people that continue to use. It's very hard to regulate things like their mood and their sleep, their anxiety level, and that's a discussion, you know, that you really need to have with them. But working with people with addiction issues, it is important for them also to understand that it is a chronic disease, and you know, and that there are things that we can do to help that. I think that a lot of them have had a number of treatment failures, I guess I would say, and that they can understand that, you know, we have things that we can help you. We can help you.
Yeah, it's never quite because we hear that a lot, like, oh, this is my last chance and my last ditch effort. If the ketamine doesn't work or the transcranial magnetic stimulation doesn't work, nothing will. We have to assure them, like, no, there's always something. So, well, thanks for coming on the show. And again, if any of this has resonated with any of you, Tamara's open for business here at Ascend Health Center. So you can see her either as your psychiatric nurse practitioner, or we also accept patients who go other places for our specialized treatments. Whatever works best for your care. We're extremely collaborative. So this has been the Ascend Health Show, and thanks for watching.